Okay, good morning and welcome everyone to today's edition of the Mental Wellness Awareness Training. This event is hosted and organized by Silent Scream Foundation, a nonprofit organization in Ghana that works in the field of mental health care access, awareness, and destigmatization of mental health issues. Today's event is a mental wellness awareness training on the topic Introduction to Rights-Based Advocacy. Our speaker today is Mr. Dokurugu Adam Yahaya. He's a Programmes Manager of BasicNeeds-Ghana, a nonprofit organization in Ghana. He has 17 years of experience in providing community-based support and program development in mental health and building networks for advocacy. He's bringing his years of training and expertise to the conversation today, and we are grateful to have him. So for some housekeeping, kindly note that today's session will be recorded so that it can be revisited by participants in the future. It's also been made available to those who can't join us today. So please make sure to share it when it comes out so that those who are not able to be here today can also take part. Kindly remember to keep our mics muted to avoid disruptions so that we can all hear the speaker clearly. Please take notes of any questions that will come up while our speaker is presenting. You can type those questions in the chat. You can type them in the general chat, or you can send them directly to the Silent Scream account. At the end of the talk, the 30-minute mark, we'll collate the questions and present them. Finally, this event, like all the previous ones, is free, and this is made possible through the work of the Silent Scream Foundation. Please find us on Facebook and LinkedIn at Silent Scream Foundation. You can visit our website at silentscreamfoundation.org, where we also provide access to mental illness professionals and counselors. Alternatively, you can Google Silent Scream Foundation and the website will come up. You can learn more about what we do through these channels. Please make sure to like them and share so that our work can reach a wider audience. Thank you, and we hope to have an enjoyable and informative morning. Sir, please, you can start.
Thank you very much, and good morning, good afternoon, wherever you are joining us from. As you mentioned, my name is Adam. I work with Basic Needs Ghana, and I'm also the Mental Health Integration Advisor of the Ghana Somobi Jumadie. As you can see at the top left, you see a logo and you see the name of the organization that I'm currently seconded to. And this presentation is actually based on a toolkit that the program developed to support other organizations or partners that we work with that are working to support advocacy in mental health to use. So at the end of the day, if you visit the website of Ghana Somobi Jumadie, you will have access to the toolkit itself. So we are going to look at what human rights are, human rights-based advocacy, and the steps in the advocacy process. And the last bit will be networking in rights-based advocacy. So our main objective today is to want to see how we can deepen our knowledge on rights-based advocacy as a tool for engaging with duty holders. And then at the end of the day, we want to see an increased use of rights-based advocacy to promote the rights of persons with disabilities, including persons with mental health conditions. So I believe that we have all talked about human rights. We've all talked about our rights, my right, etc., etc. So we are not going to belabor that. Let's move to the next slide, and then. So we want to begin by saying that human rights basically are the rights of people, and people have rights, which we usually refer to as basic rights and freedoms and this is regardless of where they are born, their color, religion, ethnicity, or other criteria you may want to use. But the fact that a person is human entitles the person to these fundamental human rights. And we want to say that human rights emanate from a number of sources. You find rights of people enshrined in their national constitutions. And in Ghana, uh, the chapter on human rights is chapter 5 of our constitution. And then there's the 1992 Republican Constitution of Ghana. Then we also have the Universal Declaration of Human Rights, and that one is enforced by countries that sign up to the UN Declaration on Human Rights. Then we also have uh, conventions. Conventions are usually agreements covering specific issues, but they are less formal when it comes to enforcement. So we have the Convention on the Elimination of All Forms of Discrimination Against Women. Then we have the UN Declaration, the United Nations Convention on the Rights of Persons with Disabilities. This is very important to us because we are talking about rights-based advocacy in relation to the rights of persons with mental health conditions and to a large extent persons with disabilities. Let's move on. Okay, so we have principles of human rights. Human rights have principles, and then these are some of the principles that underlie human rights. And to say that human rights, and human rights are universal. So the rights, human rights in Ghana is not different from human rights in the United States of America. Human rights in China are supposed to be the same as human rights in maybe South Africa. What we're saying is that once it has to do with people, the rights are supposed to be universal regardless of the person's location. Then we're also saying that human rights are indivisible. So a person cannot be granted some rights that no, you can only benefit or enjoy part of this right. But we also want to note that when it comes to the enforcement of human rights, in spite of these principles that we have, there are limitations imposed by individual countries depending on their peculiar circumstances. But what we want to note is that human rights are indivisible. That means that you cannot divide human rights and say that these ones, yes, you are entitled to enjoy, and that one you don't, you have to benefit from these rights. Then human rights also recognize equality and non-discrimination. So you hear us saying equality before the law. We are all equal before the law, both men, women alike, are equal before the law. And then uh, we also look at accountability when it comes to the enforcement of human rights. How do we do we hold ourselves accountable, or how do we hold duty bearers accountable to ensure that those rights are actually granted? And when there are violations of those rights, steps are taken to address or remedy those violations. Then the last one we'll be talking about is the inalienability of human rights. So that is to say that you cannot take away the rights, human rights of a person, or you cannot force somebody to give up his rights as a person. So these are basically the principles of human rights. Some books will have more than that, but essentially they are wrapped up in these five principles. Then we have the classifications of human rights. You will see that we have put civil and political rights together as rights that are granted by the government or civil society, and usually referred to as civil rights or political rights. Some literature will actually put political rights and civil rights as separate. Then we have economic, social, and cultural rights as rights of individuals that uh, governments or states promote, and it is intended to remove or eliminate social inequities, uh, and then remove economic imbalances and those disadvantages that that are caused by nature, and limit the benefit of rights as persons. Then we also have what we call collective or solidarity rights. So this one usually will focus on the rights of a group as a collective rather than looking at the rights of individuals within the collective. So we are talking about rights of persons. So these can be seen as collective rights. Right. So we also want to move forward to look at rights-based advocacy. I believe that generally we have all, in one way or the other, been involved in advocacy generally, where we look at advocacy as being a set of organized or structured actions that a group of individuals or an individual organization for the purpose of obtaining or a set of policies, or introduce a legislation, issue that they think needs to be addressed to improve the lives of a target group of people. So, generally, when an individual or organizations engage in those set of targeted actions, we say they are engaged in advocacy. But we want to look at how does this general definition of advocacy differ from rights-based advocacy. So we have the needs-based advocacy, which will look at what is it that is required or what is needed here. But in the rights-based advocacy, we are looking at what rights have been violated and how does that affect the lives of those whose rights have been violated. Right. Now, there are certain principles that underlie rights-based advocacy. The first one is participation. You hear this mantra that persons with disabilities usually say that nothing about us without us. So even in rights-based advocacy, and in the actions that you pursue. There is partnership and collaboration, definitely, that you might be pursuing to change a people that you cannot do as an individual or as an individual organization. And for that matter, you will need a collective, you need to build, a consortium or wider stakeholders to be involved to ensure that you catch the attention of duty bearers. Then we also have maximizing opportunities, taking advantage of national or global events to draw attention to the issues that you want to be addressed. So a few days ago, we had the International Women's Day. So if there were issues that as a country or globally that needed to be brought to focus, that is a moment or that provided a great moment, to push those issues that we want to be addressed or we want change using such a global platform or global moments where the whole world, is paying attention to issues around women. Next slide. Then we will also look at communication. Whatever advocacy you want to do, if it is not communicated, if it is not presented in a manner that is convincing, if it is not presented in a manner that can catch the attention of the target audience, then it will not be meaningful. So one of the key principles in rights-based advocacy is to ensure that you seek to influence and secure commitment to address your advocacy issue, and that is contingent on the way you package the advocacy message for the target audience. Then we also say that in rights-based advocacy, it is important to ensure that the group whose rights have been trampled on, or whose rights have been violated, or whose rights have been undermined, are part of the process. So getting them involved is what gives more legitimacy to your advocacy actions. So for instance, if you are looking at possibly an amendment to the Disability Act of Ghana, which is currently undergoing some revision or some amendment to ensure that issues that have not been addressed since the law was passed or the act was enacted, you cannot do that without persons with disabilities playing a key role or being part in this action. So user-led, that is those who are affected should be part of it. Now, how do you engage in your advocacy? So essentially, you have lobbying as one way, you have media advocacy, you have campaigns, and you have activism. So in any of these approaches, you need key materials. Some people will put a briefing package together. Some people will put a policy brief. Some people put a fact sheet together. Some people will issue press statements. Some people will also just have key highlights or points that they want to either share with the media, they want to use those for lobbying, etc. But at least whatever approach that you use or you adapt in your advocacy efforts, at least you may use any of these materials to support your advocacy action. Now, this is where we will spend a bit of time uh, in this presentation. So let's look at the steps in advocacy. Now, in advocacy, the aim is usually to secure a change on an issue. So you first of all need to identify what the issue is. So there are different ways of identifying the advocacy issue. It could be from a research. Others use what we call a problem tree analysis, and so there are various ways by which you identify the problem. It could just even be from reports and complaints or even from observation, but it is important to identify what the advocacy issue is. So for instance, in Ghana, one of the major problems persons with mental health conditions face is inadequate psychotropic medicine supply. Okay, so if you move beyond the 3 psychiatric hospitals, that is Pantang, Ankafo, and then Accra Psychiatric Hospital, most of the districts usually don't have a good stock of psychotropic medicine. So that could be, an issue you want to address. And how did you identify the issue? So as I mentioned, you have the problem tree that you can use to do the analysis to arrive at your concrete problem for which you want to address. So people may be seeing the top. For instance, we don't have medicines in hospitals. At the top there, so how does people see the leaves? But what happens, may be at the roots. So possibly there could just be no funds. There are procurement problems. And how does that happen? You will see that manifesting in the mental health units having stockouts. So that will be around the stem, and then what you see is the lives of persons with mental health condition, their mental health not being properly taken care of. Okay, then you need to have an objective. You need to have an objective. So I gave the example of inadequate psychotropic medicine supply. And what is going to be the objective of an advocacy in that direction? It will be to improve the supply of psychotropic medicines, to enhance the well-being and mental health of persons with mental health conditions. We also have an example here. We can talk about limited women's participation in development, and the objective is to increase women's participation and thereby contributing to gender equality. So in rights-based advocacy, you need to have an objective. Then your target audience. So here the target audience is referring to those you are seeking to change, or those who will be involved in the change process. So who are you targeting? Who can contribute to bringing about the change? You want to look at their interest. Are they interested in the issue? Even if they can change the situation and they are not interested, you need to understand what is their influence. Do they have low influence or they have high influence? Are they willing or reluctant to engage on the issue? You need to identify these key stakeholders to be able to engage with them properly. So you can use what we call a power map, or you can use this stakeholder uh, analysis, where you look at uh, the level of power of the stakeholder and the interest of the stakeholder, and that determines how you deal with the various stakeholders. So for those who have low power and then low interest, you need minimum effort to deal with them. But if the if the stakeholder has low power and have high interest, then you need to keep the person informed about how you are progressing with the advocacy. Similarly, where the stakeholder has high power, and then low interest, you keep the person satisfied on the issue that you are working on. And how do you do that? They just want to keep them informed about how you are progressing. Then there are those who have high power and also have high interest. These are those who you need to manage very carefully, because they can make or unmake, your advocacy actions or efforts. So you need to have a good analysis of your stakeholders. Then we also say that you need to develop your advocacy message, because it is the message that you are going to use to change or to convince or to influence your target audience. So it must be well packaged, it must be catchy, it must be convincing, and it should be a message that is sellable, or it should be presented in a format that is easy to accept and understand. Can we go? Right. Then you need to build support. Um, you need to identify allies, because it is not everybody who is interested in your advocacy actions. It is not everybody who believe that persons with mental health conditions have rights to the extent that those rights are violated. So you need to build support or organizations, to support them. I remember when Ghana was trying to introduce the Current Mental Health Act 846 2012. At some point in time, we had to bring together, or work with other CSOs, the coalition of NGOs in health. We have what we call Mental Health Alliance, and then all other interested organizations that we felt could help add pressure to Parliament to pass the bill then. So that is a way of what building support. And the last thing that has done was to include the mental health service users themselves to be part of the advocacy. And that really worked when the persons with mental health conditions themselves began to speak about the need to have the Mental Health Act. Then advocacy can be a very expensive venture, because sometimes it doesn't take a single action, it takes a series of actions over a long period. So it requires substantial human and financial investment. It also needs a lot of coordination to keep your allies and the supporters, interested. You need to sustain interest, and then to ensure that, you maximize the skills, the opportunities, and the time and resources available, to you. But the important thing I want to mention here is that advocacy is a painstaking exercise. It takes time to bear fruits, and you will need to have resources to be able to engage in effective rights-based advocacy. Now, when you are when you come up to say, okay, we want to advocate, for the inclusion of persons with mental health conditions, for instance, to benefit in resources allocated by metropolitan municipal and district assemblies for persons with mental health conditions. Do that in a vacuum. You need to have an advocacy action plan where you determine to do that, who is going to perform what role, and then the objective of the actions that you are going to take, and the time frame within which you want to do it. So when you do that, it gives you a working document to implement. So, and once you have your advocacy action plan, you now have to determine whether your implementation strategy is going to be lobbying, when you are going to do the lobbying and who you are going to lobby, whether you are going to use media campaigns or activism. But the important thing is to make sure that you prepare your key messages, fact sheets, the press statements, and talking points, so that when it comes to implementation, you are able to use that. So you realize that as part of advocacy, recently there there was the issue of the establishment of the mental health tribunal, as required by the Mental Health Act 846. Now, the tribunal had not been formed since the act was passed in 2012. So, how did we support in uh, advocacy to do this? One of the things we took advantage was the killing of the young man at Circle, by a lady with a, if this person treatment, okay, she wouldn't have been. So we saw that not providing adequate treatment for persons with mental health conditions was a human rights issue. Okay, so one of the strategies we used was to issue a press statement that went, very viral. So, but the important thing is to have an action plan that you can follow and implement. Then, once you have an action plan and you begin implementation, it is good to, from time to time, stop to reflect on what you have done. What have we achieved? How did we achieve what we have achieved, so that you are able to measure progress towards your advocacy objectives, and then how efficiently you are deploying your resources for advocacy. So let's look at the last one, which we want to say that in advocacy, we have already alluded that you will not be able to do everything on your own. So you need to network with other like-minded individuals or organizations. And I believe that we are all familiar with networking in computers, you know, where you're able to bring different systems and workstations and equipment to work together. So we're saying that in rights-based advocacy, the advocacy networks, are groups or organizations of individuals that work together to achieve change in policy or in a law or programs on a particular issue. So in Ghana now, you have lots of organizations that human rights based organizations. Okay, so you have Human Rights Advocacy Center, their activities support the human rights of persons, whether with mental health conditions or women or whatever. It is about human rights. There you have Basic Needs Ghana, you have Ghana's Homobijumadi, site savers. You have a lot of organizations, and all these organizations, in one way or the other, say that, look, we want to ensure that we work in our individual organizations to promote the human rights of people. But there are issues that they cannot achieve, or changes they cannot achieve on their own. So in those areas, you see them coming together. So you have coalition of NGOs in health. Okay, so they are saying that all of us are interested in issues of health, but there are issues that we must necessarily come together to be able to successfully advocate. Otherwise, we will not be successful. So networking and rights-based advocacy is to ensure that you build, a stronger platform, a stronger voice, that will ensure that the issues you are trying to drive change or to seek improvement, you know, uh, is given the needed push by the sheer numbers. So thank you very much for your attention. So I'll pause here. If there are contributions, if there are questions, we will take that. And let me also say that you can visit the website of Ghana Somubi Jumadie. You can access the rights-based advocacy toolkit, based on which this presentation was developed. You can also visit the website of Basic Needs Ghana for additional information on our work with the persons with mental health conditions. Thank you very much.
Thank you, Mr. Adam, for this very informative talk. So now we'll begin the question and answer session. So if you have any questions about anything that Mr. Adam said, you can kindly let us know in the chat, and then he will provide the answers for us. If you have any contributions so that you want to give, not necessarily a question, you can let us know. Mr. Adam, please, if there's also anything that you wanted to add, you can also feel free to do so before the questions come in.
Okay, right. So just a second. I just want to give very practical examples of some of the advocacy actions that we have been able to support successfully. Um, you realize that in Ghana, there is a provision that disabilities are to receive support from the District Assembly Common Fund. Now, what has happened in the past was that persons with mental health conditions were, visibly left out in those benefits. And the reason being that most persons with disabilities did not see persons with mental health conditions to be part of the disability fraternity. And even when mental health or was admitted by the Ghana Federation of Disability Organizations to be part of the disability fraternity, there was still resistance at some district assemblies to provide or extend support to persons with mental health conditions. So one of the advocacy strategies was to have direct engagement with key officials of district assemblies. First of all, to provide opportunity to clarify and to explain the status of persons with mental health as persons with disabilities, but very obvious or very visible disability that is more disabling than many other disabilities. Now, so these engagements provided opportunity even for persons with mental health conditions and their primary caregivers to provide explanation as to the nature of their disability and how they are being excluded from benefiting from the common fund is worsening their mental health situation and general well-being. So you remember we mentioned that one of the principles of rights-based advocacy is user-led, and that is beginning to change the narrative that most district assemblies are now purposefully, deliberately, planning to include persons with mental health conditions, in their disbursement of the common fund. Then, if you look at enrollment into the National Health Insurance Scheme, the same approach has been used, and engaging district scheme managers, has proved to be very effective. That look, these people are now coming at our offices. They are now knocking at our doors to tell us, uh, uh, by law, they are supposed to be registered as indigents onto the National Health Insurance Scheme, and you know, they have opened up to say that, look, insofar as they will come, we will register them. And where it is difficult for them to come, we will see how we can arrange to take our equipment to where they can be organized for us to register them. And it is all because we've adapted the user-led approach. First of all, to let the duty holders recognize how, failing to support persons with mental health conditions as their mandate requires them is affecting their mental health and overall well-being. Um, we we also have I mentioned the passage, the inauguration or the establishment of the mental health tribunal and the visiting committees. One advocacy strategy that we use also had to do with making sure there is user-led or those directly affected, take part directly in the advocacy. So I remember during the 2022 World Mental Health Day, uh, Ghana Sonwich Madie, you know, through the Mental Health Alliance led by Basic Needs Ghana, worked with mental health service users, persons with mental health conditions and their caregivers, to say that, look, there are abuses that we experience. We have challenges and issues that, border on our human rights, but there is no complaint mechanism. We don't know where to complain to because there is no visiting committee, so nobody goes to check what is happening, sometimes in a traditional healer's home or at times in the mental health unit. But if there is a complaint mechanism and violations occur, they will be able to, bring that to the attention of authorities. And they made a very strong argument that because there is no visiting committee or there are no visiting committees, when their rights are violated, there is no avenue for complaints. And believe you me, within weeks, Vox using the voices of the in less than a month, the visiting committees were inaugurated. Now, what I want to say is that it may not just be that single action, of our organizations. It could have been a collection of actions or a series of actions by different stakeholders. But just to emphasize that in rights-based advocacy, it becomes very effective when the direct beneficiaries of the outcome of the advocacy are involved. And also to just say that, yes, attribution is very important, but we also need to recognize that it takes multiple stakeholders in most advocacy actions to get the desired results. So we need to recognize that, yes, although you will be playing a role, others are equally playing a role, as I just cited the establishment of the mental health tribunal and the visiting committees.
Thank you, Mr. Adam. We have two questions in the chat. So one is asking if Basic Needs Ghana is open for collaboration with regards to rights advocacy and mental health projects. And then the other is asking what movements are in place to empower vulnerable populations in Ghana, such as the elderly and children, who often find themselves being controlled by caregivers.
Okay, so could you please ask one at a time? Let me hear the first one.
Okay, sure. So the first one is about if your organization, Basic Needs Ghana, is open for collaboration with regards to rights advocacy and mental health projects. So I think collaboration with other organizations.
Yes, definitely we are open to collaboration. with other like-minded organizations. So at the moment, Basic Needs Ghana is leading what we call the Alliance for Mental Health and Development. So the Alliance for Mental Health Organizations is made up of NGOs and CSOs, individuals, and some government organizations that have agreed to include mental health advocacy in their ongoing programs. So it is a way of expanding or extending the frontiers of mental health. So it is a loose alliance, sort of. So anybody can join at any time. And then once we all agree that this is the direction of advocacy we want to take, then we all agree and then we implement. So for instance, in 2020, when there was the outbreak of COVID-19, what the alliance agreed to advocate on was that, look, there are interventions going on, but there is no specific intervention targeting persons with mental health conditions as far as COVID-19 is concerned. So, and when it even came to vaccination, during the early days, it wasn't everybody who had access to COVID-19 vaccination. So our advocacy was to the effect that we wanted uh, vaccination of persons with mental health conditions to be prioritized. You know, in 2022, our advocacy focused on the establishment of the mental health review tribunal and the visiting committees as an alliance. And even in 2020, when the old board of the Mental Health Authority was dissolved, it took almost 2 years for a new board to be reconstituted. So, constituting the board to ensure that they provided the strategic direction for the authority, became one of our key advocacy actions. So yes, we are open to uh, collaboration, and the alliance is a very good opportunity, for us to collaborate together. Then I see, what are the movements in place to empower more vulnerable populations in Ghana, such as elderly and children. Okay, as the elderly and children often find themselves being controlled by caregivers. All right, so let me say that the disability movement in Ghana is still growing. And I tell you, the Ghana Federation of Disability Organization is a very strong organization and a very independent. There's even a council, National Council on Persons with Disabilities, with the Secretariat. So this is a very strong and up and doing structure that is able to do things on their own. But when it comes to issues of elderly and children, there is still some way to go. Issues of the elderly and children and vulnerable women is addressed or handled by the Ministry of Gender, Children, and Social Protection. Now, for children, and especially for children with disabilities or mental health conditions, there is a state they still need a lot of care, they still need a lot of support of their primary caregivers. So, and I even think that globally, I understand that the disability movement, especially in Ghana, did not start with persons with disabilities themselves. It started with the caregivers. Then a time came the persons with disabilities themselves were empowered to be able to take over. And I think that even where caregivers are still involved, it may not be for an indefinite period. And that is why there is ongoing capacity building, there's ongoing training, there's ongoing sensitization to ensure that the the persons who are affected themselves, take over the reins of advocacy, they take over the reins of leadership, on issues that affect them.
Thank you, Mr. Adam. Okay, so there's another question here. It says local government is supposed to actually implement relevant legislation. Why then is the process inefficient or non-existent?
So this is not peculiar to Ghana alone. The insufficient or non-existent implementation of relevant laws is a typical characteristic of most developing countries. And sometimes, having worked in the local government service for some time before, sometimes the non-implementation is purely as a result of inadequate resources to even, implement. There is usually non-enforcement or unwillingness to enforce where there are violations. I tell you, we have very good laws, a lot of programs in place, but when it comes to implementing those relevant laws and provisions to improve upon the lives of vulnerable persons, that is where the challenge is. And where the state is the biggest, is the offender, it becomes a very difficult thing to handle. If it were just individuals, if the state provided the needed resources, if the state provided the mechanisms for legislations to be implemented, or for acts, or for programs that will improve the lives of vulnerable people, were implemented, then they would have been in a position to hold people accountable for non-implementation or inefficient implementation. But the state, in most cases, does not provide enough resources. If you look at common fund uh, disbursement, for example, assemblies are old. Sometimes funds can be in arrears for and take on a district chief executive or a district coordinating director for not supporting persons with disabilities under the common fund, because the fund for persons with disabilities is tied to the release of the assembly's common fund. So it is a problem that is bigger experiencing. It is a problem that affects not only vulnerable groups, but it affects the wider population. But it is basically a developing country phenomenon that, we all need to put our hands on deck to see how that can be addressed. And that could also be another issue of advocacy.
Thank you. There's a question here. It says DEPP has come to stay for at least 5 years. The country is in financial crisis, bordering on crisis. How can mental health advocacy help Ghanaians in dealing with this very difficult period?
Again,
Okay. DEPP has come to stay for at least 5 years. The country is in financial crisis, bordering on crisis. How can mental health advocacy help Ghanaians in dealing with this very difficult period?
now this is way beyond what we can do, but the domestic debt exchange program, yes, I agree, is a big problem. I believe that even with the current economic hardship, is a recipe for disaster, because people's well-being is affected, people's mental health is being affected. People cannot meet basic needs, and all that contribute to worsening, their mental health conditions. What I think we can do for now is to see how we can encourage peer-to-peer support. How people can find strength in their numbers, how people can stick together to provide uh, the peer support that they need, that they hitherto cannot get because of the crisis that we are going through uh, as a nation. But as I said, this is a bigger national problem that we can only do what we do best, that is to advocate for improvement in continuous provision of mental health care, so that those who will need mental health care, or those whose mental health would have been affected by the DDEP, will also get opportunity of being treated when they have challenges with their mental health.
Okay, thank you. So there's one question and then one comment. So for the question, it says, looking at how expensive mental health advocacy is, what are the available funding sources for mental health organizations, both abroad and in Ghana? And how easy is it to access them?
Right. So, as a mental health advocacy organization, over the years, our source of funding has been through donor funding. And I should say that Basic Needs Ghana has been very grateful to Comic Relief, uh, uh, DFID, now Commonwealth Foreign Development, FCDO, that is Foreign Development organization, office, FCDO, then Comic Relief, then the EU, and at the moment, Basic Needs is in a consortium partnership with other four organizations, as you can see on the presentation on the first page. So it has been through these donor organizations that have mainly funded the activities of
Hello?
of the Mental Health Authority, FC, the gained grounds. So yes, that is the submission. Okay, so when these agencies have funding available and they advertise, and your proposed action fall within the criteria, then you put in an application. So that is how it has been over the years.
Thank you. Okay, so for the comments, the person says, some of the daily rights violations we experience are those where there's no avenue for people to report and be taken seriously. For example, sexual harassment in the form of catcalling, among others in the streets, or verbal abuse in the form of insults. This all affects mental health. And then for the question, says, how come most efforts are metropolitan centered? Issues are actually rural.
Okay, so on the earlier comment, I agree that there have been very little done to ensure that abuses or violations such as sexual harassment is brought to the fore. but the organization that I work for, Ghana's Home with Humadie, Basic Needs Ghana, Site Savers, King's College London, and all these organizations, in this program is ensuring that persons with mental health conditions, persons with disabilities are being sensitized. They are being trained on safeguarding. They are being trained to be able to identify what the red flags are. They're being trained to identify what constitutes a safeguarding concern, and they are encouraged, and provided avenues or channels they can report incidents or violations, for redress. So at the moment, there is training ongoing, for mental health self-help groups, training them on safeguarding at the community level, so that they will be able to identify safeguarding concerns and report them appropriately when they occur. The important thing is that, first of all, we want to prevent incidents of safeguarding from occurring. But when they occur, there should be ways of addressing them. And these trainings are not just for the health help groups, it is also for the staff of the organizations in the consortium, and it is also meant for our volunteers and all those who represent us as an organization, or all those who are using funds provided by the donor. You, they must be conscious of safeguarding incidents so that they do not use their positions or their influence to perpetuate abuses against vulnerable groups and individuals. Yes, and I agree that efforts, well, um, issues are usually rural, but there are also issues in the urban areas or in the metropolitan areas. The fact is that in most developing countries, development interventions are first of all driven towards, the metropolitan and already well endowed areas before they even get to the rural areas where most of the problems are. So that is something that I will not be able to answer adequately. Maybe the development practitioners will be able to do that. But I think that there are problems which cut across both the highly urbanized areas and the very rural or poor communities.
Thank you. Okay, so I think we have one last comment here. It's a little long, so I'll try to summarize. The person is saying that it seems certain institutions in Ghana are above the law. And the person gave an example that we saw soldiers go into a community recently and assault some gentlemen. And then the person says, when you speak up, they mock you by calling you, I know my rights. Yes, so that's a comment.
Well, that is the person's sorry, that is the person's view. And just to say that, as I was explaining previously on the incidents of safeguarding and issues of harassment and abuses and those things, you realize that wherever you mention that, when you touch maybe a woman in a manner that she considers inappropriate or in a manner that she feels uncomfortable about it, most people are like, oh, but just a touch. They don't think it amounts to anything. It is something that can be glossed over. So when people begin to insist that, yes, this makes me uncomfortable and I don't like it, and as a matter of right, I want, you to stop that. People obviously will look at you as either being too knowing or too full of yourself, and they say that the problem we have in our society is these people who say they know their rights. But, we are gradually going there, that, rights that have been violated in time past very soon will be issues that will be enforced, and people will pay severe penalties when they ignore those things.
Yes, please. Thank you. There are no other questions or comments in the chat. So we are going to go ahead and wrap up for now, formally. But then afterwards, if maybe people have any other contributions or stories to share, can stay behind and then share. So I want to thank Mr. Adam so much for joining us today and for giving us this very informative presentation. I think we all learned something that we can apply in our daily lives. And want to also extend our gratitude to all our friends and partners joining us all across the continent and even outside. Thank you for giving us this hour of your Saturday morning. Want to once again emphasize that all this is made free through the work of Silent Screen Foundation. And one of the ways you can support us is to share the work that we do so that other people can also have access to it and we can spread this information further. So you can find us on Facebook and LinkedIn at Silent Screen Foundation, and our website, silentscreenfoundation.org. If you know anyone who requires any mental wellness assistance or is trying to get in contact with a mental wellness professional but doesn't have access, we have all these resources on our website, so you can contact us through there. We also put our contact information in the chat so that you can also contact us directly. Please be reminded that the session was recorded and to be shared on our YouTube, Silent Screen Foundation. So you can share the link to those who are not able to join us today. Or if maybe you want to revisit something that happened in the conversation, you can also go back and revisit that video. So I want to thank you all once again for joining us. We hope you have a wonderful weekend. Thank you, Mr. Adam.
It seems there's a hand up. I don't know whether it's a new hand or it has been up for some time.
Okay. Yes.
Okay, thank you very much. So this is open discussion section. So I had a question. So let me just bring that up. So I noticed that most of the conversation and advocacies are for mental wellness at its extreme. But mental wellness is actually, for me, where I sit, it's like a spectrum, and there are some that is as, if you like, as minor as stress, and also as bad as it can go. My question is, do we have any, is the concentration of this advocacy group on the whole spectrum or just a certain section of the spectrum?
Hello?
Hello, did you hear me?
No,
So my question didn't come through. Okay. Moderator, did you hear my question? Hello?
Hello.
Did
Sorry,
anybody
the
hear?
network is cutting out.
Oh, okay. So let me see if I can ask my question again.
Okay.
Hello, my question is, I noticed that most of the advocacy activities that have been carried out are at the extreme end of the mental health spectrum. So my question is, do we have any advocacy or support in the lower end of the spectrum, such as people suffering from stress or depression, that are not as, as dramatic or as demanding as those? I think they are equally demanding though, because for me, the question is, it's a spectrum. We seem to be concentrating on the higher end. How about the beginning end, where people might need support in that area? Do we have any advocacy groups for those areas as well? I hope my
Well,
question
so we're
came
looking
through.
at, yes, we're looking at mental health advocacy as in its entirety. It is just that sometimes we prioritize the extremes, but at least even for, let me say, access to affordable mental health services is a basic need. Okay, so if there are no mental health units, or if there are mental health units and there are no mental health officers to deliver, it could be problematic. If people have mental health care needs at their workplaces, that is not recognized as a problem, but is interpreted as maybe a behavior to stay away from work. That is something that needs to be looked at. So yes, we don't want to push or assume that these are minor issues of mental health, and then those are extreme, but we want to give attention to only those things that are extreme. I should say that whatever is seen as extreme today was once minor. So yes, our attention should be to see how we can address issues of mental health uh, holistically in our advocacy engagements. It is true that there are times we need to focus on specific areas, because there are times you need to do that. For instance, you can be looking at the economic empowerment of persons with mental health conditions. You can be looking at the other health issues of persons with mental health conditions. You can be looking at the mental health. You can be looking at issues of stigma. You can be looking at discrimination and exclusion. So depending on the focus of the Hello, are we still there?
Hello, Mr. Adam. Hello.
Yes.
Yes,
Hello,
you
I can
cut
hear
off for
you.
a while, but I think we got most of what you said. Hello.
Oh, all right.
I don't know if it's
Hello,
even
yeah, I
from
can
my
hear you.
side.
Okay, so any other comment